Now you come here, and before you don't do anything at the front. So you come here, and if it's a boy, and this one is a boy, you're going, as you clean it, you're going to put the scrotum on the side gently against the thigh and feel for a little less than a pinpoint, and that is the testes. You'll feel the testes that are descended, not distended, descended, come down. Okay, so you feel that. You feel that? That's okay. Please, boys and girls, you have to wipe front to back, not back to front. So with the girls, you wipe front to back, and you might see discharge. Sometimes you'll even see bleeding, and that is okay. And scrotum might be enlarged too, and that is okay until unless there's a birth injury. But the scrotum is enlarged because there are leftover hormones from the mother. So let the mother know that your child even might bleed, girl might bleed like menstrual cycle for 7 days. That is very normal. That's because of the leftover hormones of the mother. Don't, especially a teenager, you need to teach before they panic. So teaching is very important in all this stuff. Make sure they're keeping the baby dry at all times. And please, while you're looking at this and feeling the chest, you need to know for retractions. I forgot to tell you that. If there's inward going on, the baby should not be with the mother. That means the baby is having problems breathing, and we need to help. So the sternum retraction, it's not good. But if they have even abdominal retraction all the way to abdomen, that's even worse. You need to get the baby into give some kind of oxygen blow off, oxygen deep suction the baby, do anything to get this baby's breathing at the normal pace. So please understand, retractions are also important. Accessory muscles should not be used while they're breathing as well. So they will be breathing fast. Up to 60 is normal for the newborn. So please understand, 36 to 60 is normal for newborns. And heart rate will be from 110 to all the way to 160. That is normal. All right? So if it's 180, if the breathing is less than 36, and if the baby is grunting, snorting, and retractions are going on and struggling, I would have to have the baby away from the mother. So all this, all the time, watch, and it's very important to keep on watching. So you do this and feel for the scrotum. While you're feeling for the scrotum and stuff, you need to put your hand on the hip bone now. Hip bone is where you'll feel, all of you can feel your bone. You put your hip bone there, and now bring these legs forward like this. You are looking for hip dysplasia. Now, this was shoulder dystocia. This is hip dysplasia. It could be through the birth, especially if the baby has been breached. It's important. If the baby was posterior to the mother, that means baby's back and mother's back were at the same time, which is a very extremely excruciating back labor pain. If that is happening, then there's a possibility that this baby will either have shoulder dystocia, and it could have either or both, and hip dysplasia, especially if the baby is big. So please understand, you look for that. So quickly go ahead, while you're doing this with one finger for the scrotum with the girl, with the boys, you go like this, put your hand on the thing and go. Again, men will hear the click. Most of the time they faint when they hear the click. I've seen it. I've seen husbands faint when they hear the click. You women most of the time feel it. There's something in epidural, the same thing, or spinal. Men hear something and they faint. Women don't hear it. So there's a difference between sounds. There's certainly men hear than women. So you most likely will feel it. So you'll feel a click. That's not a good thing. You need to get at least an orthopedic doctor and any doctor to come and check to make sure that if the baby needs to be in a harness. And by the way, the harness will be there for about a year or two on them. So please understand, because they need to put that bone continuously in the socket. If it keeps on coming out, then there'll be a lot of damage. So that's why they have to be in the harness till the muscles are developed so they can do it. You'll also see other issues with hip dysplasia, which you're going to tell me. I'm not going to tell you. So you clean that up, you come down, and then you go here. As you're cleaning the feet, mom, I'm just cleaning the feet. Look at the fingers. Distract the mother to check if there are 5 fingers and stuff like that. We're doing this because you're going to do several things here with the baby. The first thing you're going to do is called, this was grasp reflex. This is, you put your hand right at the plantar, and the baby's hand automatically will try to curl its toes. That means it's called plantar reflex. You'll try to hold your toes. Now, as soon as the baby starts to move and stuff like that, the plantar reflex goes away. By the 6-7 month, the plantar reflex will go away. That's the plantar reflex bilaterally. Then you have to do Babinski. In newborns, up to the age of 2, Babinski reflex different as opposed to adults, 3 years old to adults. In children, when we do Babinski, you need to do bilaterally. You need to go from the toe and then from the toe and do a half C. So from the toe, you go like this in the corner of your finger and do a half C like this. See where I am here? This is where you do. And that is Babinski reflex. And what will happen in this one, the toes, instead of in adults, they will curl up. In the children, in the newborn, up to 2 years old, because they are not working that much, they will flare up. So adults, if I was to do your Babinski, it will curl up. You'll go like this. In children, in newborns, they will flare up, because that's the Babinski reflex. That's very good. Then as you're talking to the mother and saying, who do you think you look like, you do like this. Flip the baby in the heel. So very quietly flip. This is plastic, so you can actually hear the flip. When you hear the flip and baby goes like this, you just say, oh, it's wonderful, the baby is crying. It's removing all the fluid from the lungs. You don't tell the mother, I flipped the baby. You're looking for a Moro reflex. Sternal or Moro reflex. If the baby goes like this and try to put the feet inward and go like this, that's very good. It's intact. Baby is intact, and neurologically baby is intact. So it's important to check for Moro reflex by just flipping the baby like that. The mother should not know it, because they're supposed to be cleaning it and doing it internally. By this time, maybe you should, all this is, by the way, cleaning the baby is to be in 1 minute, because you need to dry this baby as quickly as possible. Within 1 minute, you're getting your Apgar as well, because your Apgars are 1 minute, 5 minutes, and 10 minutes. You need to give me the Apgar in the right order. So now we're going to come to the front. So we're coming, and Mom, I have to clean the baby's front. Here I'm supporting. Always support this. Again, tell the mother to support it, and go ahead and put the hair against it. I'm just going to dry the baby. So now we're going to dry the baby. If it's a boy, I highly recommend that you put something here, otherwise you're going to be baptized in the name of urine. So make sure that you go ahead and put this here, or else you'll be baptized. If it's a girl, it will trickle down on the mother. So, and that's okay, because mother needs to have a bath pretty soon. All right, so you're going to do it. Many times there will be a third nipple. For a guy, a third nipple over here means there was a twin. That will calcify. Please make sure you know. Now, there's a student that I had in my class that showed us his third nipple. And for women, third nipple can be here or anywhere else. But if it's here, that means that's a parasitic twin. They call it a parasitic twin. So they have to remove it, because it will take away blood supplies for this baby as he grows up. So you need to understand it's important to remove it. Now, some religions will not remove it because they think that baby is a god. So please understand that. So remember to check. And this will be enlarged, as you can see it. Again, it's because of the leftover hormones of the mother. So if the breast tissues are enlarged, whether it's a boy or a girl, it's leftover hormones of the mother. When you're coming, as you're cleaning this, make sure that you clean it nicely and stuff. Remove the vernix, remove everything, and then clean over it. And you teach the mother, very important thing here. You quickly lift it up as you go up and look for 3 things. What is an umbilical cord made up of? 2 arteries and 1 vein. 2 AVA, Eva. Remember Eva, AVA, Eva. Artery, vein, artery. What does the vein do, and what does the 2 arteries do? I want you to tell me. Which one takes the blood supply from the mother to the baby and oxygen and nutrients? Which one takes the waste products from the baby to the mother? AVA, artery, vein, artery. 2 arteries and 1 vein. You quickly look to make sure it's intact, it's there, and then teach the mother that until when the umbilical falls off, only then do you immerse your baby in the water. Before that, you need to give her a sponge bath. Give the baby a sponge bath. And then when she puts the thing, you need to teach them, let her put it on. When she puts it on, make sure that if she doesn't have a curved, they do sell that, by the way, the curved one, and hospital charges them, each one they charge $50 to make sure you take it home. So you put it below it should not go like this. It should be below the umbilicus so that it does not get bad. So please understand how to put the diaper as well. And that's it.